NCLEX-RN Prep 2026 questions to strengthen your weak areas. Question 1. A client is receiving pyridium for a urinary tract infection. The client should be taught that the medication may: Option A, cause diarrhea. Option B, change the color of her urine. Option C, cause mental confusion. Option D, cause changes in taste. The correct answer is option B, change the color of her urine. Phenazopyridine, pyridium, is a urinary analgesic that typically turns the urine a bright orange or red color. Question 2. Which of the following tests should be performed before beginning a prescription of Accutane? Option A, check the calcium level. Option B, perform a pregnancy test. Option C, monitor apical pulse. Option D, obtain a creatinine level. The correct answer is option B, perform a pregnancy test. Isotretinoin, Accutane, is highly teratogenic. Female clients must have a negative pregnancy test before starting therapy and use strict contraception. Question 3. Which nursing intervention is most critical during the administration of acyclovir, Zovirax? Option A, limit the client's activity. Option B, encourage a high carbohydrate diet. Option C, utilize an incentive spirometer. Option D, encourage fluids. The correct answer is option D, encourage fluids. Acyclovir can cause renal damage due to crystal formation in the kidneys. Maintaining high fluid intake is essential to prevent nephrotoxicity. Question 4. A client is admitted for an MRI. The nurse should question the client regarding: Option A, pregnancy. Option B, a titanium hip replacement. Option C, allergies to antibiotics. Option D, inability to move his feet. The correct answer is option A, pregnancy. The nurse must verify the patient's pregnancy status and the presence of any ferromagnetic metal implants before an MRI. Question 5. The nurse is caring for a client receiving amphotericin B. Which finding indicates toxicity? Option A, changes in vision. Option B, nausea. Option C, urinary frequency. Option D, changes in skin color. The correct answer is option C, urinary frequency. Amphotericin B is highly nephrotoxic. Changes in urinary output or frequency can indicate early renal impairment. Question 6. A patient with congestive heart failure complains of dyspnea. Which action is the first the nurse should perform? Option A, ask the patient to lie down. Option B, draw blood for ABG. Option C, send the patient for a chest X-ray. Option D, check blood pressure. The correct answer is option D, check blood pressure. When a patient is in respiratory distress, the first priority is to assess vital signs to determine the patient's current clinical stability. Question 7. A patient prescribed nitroglycerin for angina complains of frequent headaches. Which response is correct? Option A, stop taking the nitroglycerin. Option B, go to the emergency department. Option C, headaches are a frequent side effect because it causes vasodilation. Option D, the headaches are unlikely to be related. The correct answer is option C. Headaches are a frequent side effect because it causes vasodilation. Nitroglycerin is a potent vasodilator. Headache is the most common side effect due to the dilation of cerebral blood vessels. Question 8. A patient in remission from colon cancer complains of fatigue and difficulty with concentration. Which explanation accounts for this? Option A, the symptoms may be from anemia caused by chemotherapy. Option B, the patient may be immunosuppressed. Option C, the patient may be depressed. Option D, the patient may be dehydrated. The correct answer is option A, the symptoms may be from anemia caused by chemotherapy. Chemotherapy can cause lingering bone marrow suppression, leading to anemia which manifests as fatigue and chemobrain difficulty concentrating.